IVF is a very successful technique. By successful, we mean it succeeds once in 3 attempts for most couples. Unfortunately, this still sounds as very little for many people. Now, though science has advanced a lot and we are getting better results every day, still a lot is not yet learned or known about how human beings conceive and give birth. So you'll have to understand our failure in terms of not being able to give you a 100% result per attempt. In brief, if you really want to understand why an IVF fails, we'll have to go into the whole system and understand that there could be 3 broad reasons why the IVF process did not click for you in that attempt. A. The embryos are formed outside of the body and then put back in your womb through ultrasound guidance by an experienced healthcare professional, hoping that the embryos would implant and take up and give you a pregnancy. So the points that we can go wrong are, number 1, the embryos that have been selected to put back to your womb are not healthy. This is the commonest cause. I would say it's around 70-80% reason why an IVF fails. I'll go into the details a little later. It could be because the womb was not receptive. That's around 10 to 15% of the causes. And also you have to understand, the doctor who is putting back the embryo to your womb may not be able to do it always properly and successfully. So this is the human error that accounts for another 10 to 15%. The third part we are trying to reduce and eliminate, I would say, with the help of ultrasound guidance, where we check the embryos before they are transferred at the right place and then tell you that we have been able to put it back properly. But even then they might get stuck in the mucus or some such place where they have not been able to implant into the womb. This has to be taken as probably bad luck because the doctor has the best of intentions for you. As far as the endometrium receptivity is concerned, it's a very complex thing. We realize that humans do not have a receptive endometrium all the time, all the year round. The window of implantation means there is a time frame of around 5 to 7 days every menstrual cycle when the endometrium possibly can receive embryos. If we have not been able to identify the right window of implantation for you, then the embryos, even if they are the best in quality, would not implant. Sometimes some people have deranged window of implantability. That is, it's not falling right on the time when it should. In these cases, you need to do an endometrial receptivity assay to find out when is your endometrium receptive and then plan the endometrial transfer next time around during those days. A little complex, but that's the way it is. Now the biggest part is the failure of the embryos to implant. We need to understand that out of the 10 or 12 eggs that are there in both the ovaries for most women, only one is found good enough by nature to grow up. And from 50-60 millions that sperms are there after sexual contact, only about 500 to 700 sperms come close to the egg and one gets to enter the egg. So there must be some sort of a selection that's taking place both in terms of the egg and the sperm to give you that baby. Whereas when we work with you, we give you injections to mature all your eggs that are available, take out 10 or 12 of these eggs and put them together with sperms which we think are healthy. And believe me, we are not as good, we are not even half as good as nature is. So when we form embryos, we are sure to be able to form embryos in most cases because we are purposely putting the sperm and the egg together, even if the egg or the sperm may not be of the best of quality. So this results in multiple number of embryos forming every IVF cycle. And then we have to kind of select according to our criteria as to which can implant into your womb. What has been done traditionally is to allow these embryos to grow in the incubator for 2 or 3 or 5 days and then choose the ones that are looking good. But you would know from your experience that looking good necessarily does not mean that they are actually healthy. So even if the embryos look good, if we were able to biopsy them and find out whether they are functionally good, the results would probably show that most of them are still not good enough to implant. So is there any improvement in this? Yes, there is. There are options available like embryoscope or time-lapse technique where we do not take out the embryos of the incubator and check. We cultivate them directly into an incubator with a microscope and a camera attached. So the embryos can be actually observed 24/7 throughout that microscope, and without taking out the embryos. It's a non-invasive technique. And then by looking at the embryos continuously, we try and figure out which is a better one for you. Please understand, this is a much better technique of identifying embryos as opposed to the previous technique of sporadically taking out embryos, checking them within 2 seconds and putting it back. Are there better choices also? Yes, there are. We could look at the embryos genetically whether they are healthy or not. Now please do understand also that an embryo or a human being is now known to contain more than 25,000 genes. We are not smart enough to check for all of these, but as many as 700 or 800 of these genes can be detected, and we can find out faults in these genes. So in case these embryos are faulty, then these embryos are better rejected and not transferred back to your womb. This technique is known as pre-implantation, that is before putting it back to the womb, genetic diagnosis. There are 2-3 methods by which this can be done. You may have heard of a new technique called NGS, which is now the preferred method of doing diagnosis of genetic diseases for embryos. Embryo biopsy for genetic diagnosis does not improve results. I would say that's not the right answer. Actually, what it does, it prevents failures or miscarriages. So we as of now only recommend it for people who have had multiple miscarriages or multiple failures. First case patient, young women, better not go for PGS as of now, because it's not established where PGS is completely healthy and safe for all of us. Finally, we still have to remember that there's a functional component for every embryo. The embryo, whether it's functioning properly or not, is still not well understood. This is completely new technique, completely new territory. We are not very clear as to how to detect and find out whether the embryo is malfunctioning or functioning properly. So even in the best of centers and best of hands, you could have some sort of a selection taking place, nowhere as close to what nature does. And therefore, whenever we do so, we cannot expect a 100% result every time the embryos are put back. Slowly, however, the results are approaching 90-95% for most couples. In fact, there are now a lot of centers all over the world who are claiming that there is a 90% probability of giving birth if we are allowed to put back embryos to your womb on 2 or 3 occasions. I think this is a reason to celebrate modern science.